highlight because it's important for the near future, the future trajectory for the PROMS initiative. Maybe I will highlight also only a couple of keywords. Of course, I will not summarize all the presentation, it was so rich. Maybe there is a growing consensus of the value of patient-generated data in clinical trials, but also in clinical care. PROMS hold great potential, definitely, in complement what we are doing today and probably progressively increase over time, mainly also, we said in the introduction, to be able to highlight some unrecognized progression in MS. PRO's potential to transform the development of future MS drugs, maybe be part, at least be part of this transformation from bench to the clinic. And also we need to select and identify the relevant PRO and PROMs. We have highlighted a couple of PRO and PROMs. I think it's important to highlight. I will come back just later. However, we are confident that there is still some limitation in available PRO measure tools and with recognized limitation. Maybe it's fundamental to keep the progression of research and domains interdependency, as you have seen in a survey presented by Giancarlo, as to understand what specific combination of measures should be used for each patient, also some degree of personalized approach of PRO. Measures will need to be differentiated according to each patient journey, based on many criteria, as you can see, and also reflecting the expectation of people with the disease, not the expectation of doctors. And we need to make sure that what matters to the person is also what benefits them, not only to make a point, but to know what benefits them. We need to validate if what matters more is also relevant for producing quality of life improvements. Concerning the current challenges in using the same PROM from clinical trial to care, or clinical research and care measurement today are mostly snapshots, of course, of functions and fail to capture the subtle nuances of insidious progression. So we need to identify objective measures of functional domains and monitoring MS fluctuation over time, which could be helpful for MS intervention on treatments past the hurdle of phase 1 and phase 2 clinical trials and secure wider access to care. We need acceptance from all the stakeholders, including the regulatory agencies, FDA and EMA, the industry and pharmaceutical partners, clinicians who will be using and administering the outcomes, insurance agencies, scientists also. Sometimes they're very difficult to interpret the data, as mentioned by Jeremy before, and central to all of these patients from whom who are gathering the data. And greater health authority engagement can also help producing guidance and recommendation with emphasis of the adoptions of measures for clinical practices and for the MS community. We know we have some barriers to be addressed, including availability of valid, reliable, responsive PRO measures in multiple translations. However, great health authority engagement can also help producing guidance and recommendation with emphasis on the adoption of measures for clinical practices and for the MS community. Trials are about group outcome, but we need to have a more personalized approach, new methods for quantifying treatment's effect that consider multiple outcomes on patients. Preference are needed, as in the case of net chance of benefit, statistical approach suitable to a more patient-oriented evaluation of treatment effects and outcomes, since different patients can have different priorities, as said by Maria Pia Sormani. So we need collaboration of PRO validation among different initiatives on a research project. We need to join synergies with other initiatives, such as the IMS survey from the EMSP, where joint efforts can bring to acquisition of comprehensive data. PREMS for EMSP survey and PROMS for the PROMO survey. Poorly developed PROs risk type 2 errors, as mentioned, so you have false negatives in clinical trials, resulting to erroneous failure to achieve trial endpoints. Validity, of course, is a fundamental requirement to fit for purpose PROs, with the main determinant of validity being the PROMS items, content validity. We need to take the opportunity to advance the quality of PRO measurement, also including the introduction of routine employment or advanced psychometrics methods. So now switch to the digital chapter. It's appreciated that the great availability of tools and the abundance of digital solutions currently available can provide interesting solutions to data collection of changes over time by leveraging on both active and mainly passive measurements. However, also in this era of digital transformations, it's also pivotal to engage patients, from research to development of digital devices, to be also, I would like to say, realistic in this approach. By incorporating report of experiences and preference, we can ensure the necessary level of acceptability required for successful use and data collection. And now, almost to conclude, development of an innovative survey designed by and for people with MS, ambitious launch at a global scope of translated in multiple languages with an end goal of thousands of contributions. So unique data will lead to a richer understanding of functional domains and their interdependency, also leading to a Delphi study to identify further gaps and research needed we will discuss in the next weeks or months. Out of confirming the lack of scientific consensus in the literature for recommendation of PROMS, if any role, the initiative currently studies up to 4 measures responding to inclusion criteria for high acceptability of all involved stakeholders, as mentioned by Robert in his presentation. So we have original landscaping exercise or existing e-tools, e-health tools for monitoring different domains. We have 2 interesting examples presented just before, but of course we need to continue to work because we have unmet needs to be done to address limited interoperability across different tools and levels of patient acceptability. Invitation to a dedicated meeting later in November in Madrid, Spain, to foster the uptake of PROMS in health policy making in Europe and globally. This meeting will be carrying the message of the last working group of the PROMS Initiative healthcare system. Thank you.
Thank you very much. I think very good summary of what happened today. Let me just add a couple of final considerations. The first consideration is that what we heard today is confirming the growing role that PROs are taking in the area of medicine, and particularly here, of course, in MS. Even only 3 years ago, when we started, we could not think that we can come to this level where we are today. Of course, we have to pay attention to a lot of methodological problems that have been quite well presented today, but it was reassuring to know that registries are already incorporating some of these measures. Second, the pharma companies are investing in this direction. And third, even the European agency is now interested to some concrete steps in the direction of including PROs in future evaluation of new products for treatment. I think everything is moving in a coherent way in the same direction. It's now up to us to be able to really select the more mature measures that we have. We heard a lot about the different possibilities here today, but I think we are really at a very key point in the activities of PROMS to take specific actions that have a quite clear direction. So thank you so much then to all the speakers and the contributions that allow us to have such a nice view.
Just a few words to add. Yes, my thanks to everybody who's participated. Tim, if you're still online, to you as well. You're not here, but I hope you heard the applause. Just to say, I come away from this session with a lot of optimism. Thanks for your optimism, your engagement, different perspective. Thanks for your challenges, because it's very important to keep us on our toes and not think that it's an easy job. Thanks for your pragmatism. I think we have a lot of work to do. So just to say, given that we are here in Italy, avanti, let's go onwards and upwards and do a lot of hard work next year. And I really want to thank the ECT for the many very valuable contributions they have made here. And for what Guy said during the last session he was in, to remind us that there are many other data that we need to gather and keep gathering about social and principle of life, quality of life issues that are crucial. And of course, many of the registries are involved in that. So Helga, over to you.
There's been an incredible amount of intellectual and scientific horsepower shared today, and I thank you for that. But my take-home statement today, which is an absolute gem and a diamond, comes from Jeremy Hobart, which said, unless we get the measurement right, we undermine the work. And the initiatives such as this would not be possible without the guidance and the leadership of Paula Zariton, Patrick Vermersch, Pierre Baneke, and Professor Comi. And also the support of the European Charcot Foundation, Italian MS Society, and MSIF. And as a member of the engagement coordination team, we're proud that our lived experience is heard, valued, and adds value to the learned experience and moving forward and finding the most effective management of MS. We're proud that we are able to make contributions in this global initiative, and we're committed to continue representing our views of the people that are affected by MS.